Major parts of the brain lose function as we age. However, scans of the brains of several 70-year-olds show that they resemble the brains of young people in their 20s and 30s. These people are called superagers. Superagers are people who are well past their 60th birthday but have a young brain. Elderly people with young cognitive ability, known as superagers, have larger neurons and less abnormal tau protein in neurons, which is known to be one of the causes of Alzheimer's dementia. Superagers are people in their 80s or older who have the cognitive ability of a middle-aged person. This refers to people who are elderly but have a young brain that can match the memory of young people. Examples include the practicing doctor of 80 years old and the skiing grandfather of 100 years old. Most people have brains that age and change predictably. Memory peaks between the ages of 30 and 40, but overall brain volume begins to decline in the 50s. In particular, brain areas associated with complex thinking processes and learning begin to atrophy. Hormonal changes, worsening blood vessels, and difficulty managing blood sugar, the brain's main fuel, lead to age-related cognitive decline. Generally, superagers are seniors over 80 years of age with excellent memory. He is a person with a very good memory. Although many people think they have good memories, superagers are actually very rare. Superagers' brains shrink at a slower rate than those of similar age groups and maintain the volume in areas related to memory and concentration. Additionally, the anterior cingulate cortex, ACC, which influences thinking, memory, and decision-making, is thicker. The neurons around the brain responsible for memory are much larger than those of people of the same age, and even similar to those of people 20 to 30 years younger. It contains a greater quantity and density of bone equinomo neurons cells linked to social intelligence and cognition. It promotes rapid communication throughout the brain, providing an enhanced ability to navigate the external world. This appears to combine in a way that prevents brain decline. the brain ages. They are cognitively able to overcome age-related problems such as inflammation and blood vessel blockage that average people experience. Postmodern studies of their brains have shown that some have the clinical pathology of Alzheimer's disease but do not experience any symptoms. That is, some brains may have extra capacity to continue functioning despite disease or signs of cognitive decline. Longer lifespan and healthier cognitive abilities may be genetic, but we don't know for sure. Having genes is the first factor, but genes can be turned on or off depending on environmental factors and lifestyle.